I'm going to share with you 3 common wrist injuries, their causes, their symptoms, and their treatment, and see if this can help you. My name is Huang. I'm an occupational therapist and certified hand therapist. And yes, there's a ton of different wrist injuries, but I'm going to address 3 really common ones that sort of come out of nowhere. So this is Decker veins tendonitis, this is wrist tendonitis, and then of course the dreaded ulnar-sided wrist pain. So Huang, what are you talking about? These are things that are kind of falling right here at the wrist. I'm going to talk to you like what's causing it, why does it hurt that way, and what you can essentially do about it. So Decker veins is a very specific type of tendonitis that hurts right here on the side of the wrist and the thumb. It's called tendonitis because it was founded by this doctor with that name, but other than that, it really doesn't matter. What you want to pay attention to is, does it hurt when you squeeze hard, and if you move your wrist down in this direction? This might hurt you if you are grabbing something out of the refrigerator, or maybe just grabbing it and pulling that refrigerator open. It's causing you some sort of pain right here. It's called Decker veins tendonitis. And I'm talking about these common injuries because this is chronic. It sort of comes out of nowhere. It feels like you didn't fall, you didn't drop anything on your hand or wrist. It's nothing that you've done out of the ordinary. It's like the same thing you're doing over and over and again, and all of a sudden you start noticing, hey, it hurts me this way. So this is Decker veins tendonitis. It hurts right here. You can actually find it, and if there's a little bump on the side right here, if you have true Decker veins, you can touch that bump, and we have a tendon that runs right past that bony prominence, and if that hurts, you might have Decker veins tendonitis. If you put your thumb into your palm, usually this is the test. They put it into the palm, you squeeze it, and then you move it to the side, and it stretches that tendon a little too much and it hurts, then you have Decker veins tendonitis. I'm going to go into the root causes in a little bit and what you can do about it, but that's usually where it hurts. The other common kind of vague wrist diagnosis from doctors, or maybe you're looking online, is tendonitis. So tendonitis is anywhere where the muscle meets the tendon and it gets really irritated right there. They're going to call it tendonitis. So it tends to happen right here in the middle of your wrist, right? So we have our wrist muscles actually start in our elbow and come down. One of the major wrist muscles attaches right to this bone, so it crosses right here. So sometimes instead of getting elbow tendonitis, like lateral epicondylitis, some people start having their pain more at the wrist level versus than the elbow level. So they're going to have wrist pain right smack in the middle. We have 2 wrist muscles. One comes to this to this bone, this metacarpal, and the other one attaches self to this one. So it passes this junction right here in the middle of your wrist. And this one you're going to feel when you're squeezing, or let's say you're reaching and you squeeze, something happens here and you just start having wrist pain. So anything vague like that, where literally you're like, I woke up like this, these are chronic types of issues because you didn't fall, you didn't break anything, you didn't tear a ligament. It's just a muscle imbalance and something is really irritated. So that is wrist tendonitis. The third most common one, this is what they call the ulnar side, the outside, the pinky side of your hand. And we have tendons that go right by here too. And those muscles also start in our elbow and they come across. And when you turn your palm up and down like this, that's when you could have pain over here. Sometimes you're turning your palm up and you're moving your wrist somehow or another, and it just hurts on this side. This is considered ulnar-sided wrist pain. And like I said, these are chronic. They seem to kind of come out of nowhere, but if you can think far back enough, it probably started bothering you months ago. For some people, it's been years. But you didn't fall, you didn't break anything, you didn't drop anything on there. And so you might be going to the doctor and they're going to take x-rays and they're like, your bones are not broken. And depending on your age, it really doesn't matter if you have arthritis or not. So sometimes a lot of young people tend to have this and it feels like arthritis, but it's not. right? And even if you're older and you have some bony changes, it usually doesn't mean it has to hurt. Arthritis doesn't necessarily equate to pain, right? It doesn't have to be. A lot of times these are muscle imbalances. And the great thing about muscle imbalances is that you can fix it. It's just about finding out like where the root cause is, which is why it's so important for you to go to a trusted therapist, certified hand therapist, occupational therapist, who can really guide you and figure out what's going on. Because as someone who not only treats in my clinic, but also teaches other therapists, I always teach them the most important thing that we can do as therapists is to rule in and rule out. There's a bunch of different things going on right here. If you've tried splinting, therapy, injection, and nothing is working, these are all symptoms that you should be taking to a trusted therapist and say, hey, I've already tried X, Y, and Z. What is going on? We have tendons here, but you know another thing we have here is a nerve. There's a small little nerve that comes right here, and sometimes when you're wearing a splint and it doesn't help with your tendonitis pain, your Decker veins, that means that you might be compressing on that nerve, and there's something else to do instead of just wearing a splint and rubbing the shit out of it. It's still not working. You might have a nerve issue, and nerves love heat, right? So if you're going to use heat or ice, which one helps? If you have a nerve issue, nerves love heat, and it will help it feel easier, looser, better. Also, another indication is if you stretch it. People love watching YouTube videos and stretching the shit out of it and then massaging it. But here's the indicator. If you feel like it hurts, like it alleviates you in that moment, but it hurts you later, then the thing that you did isn't helpful. You might have more of a nerve entrapment. So this is why getting to the root cause is so much more important than just watching these videos and just doing whatever guessing, right? Because you might be hurting yourself in the long run versus helping you. So this is what I do in terms of treatment. Find out what's working and what isn't working. So don't just chuck shit at the wall and see what helps you, because you might just be dragging it out and delaying it, right? So that's one of the things. When it comes to tendonitis here at the wrist, again, people love going to the drugstore and buying a splint and just wearing it. But guess what happens when you stop moving your wrist in the way it's meant to move? The rest of your arm can get a little weaker. And it's not so much that you're weak. It's just that it's weaker as compared to other muscles, right? So if you have pain, a lot of pain gripping here, instead of stretching all the time, really think about what you can do to compress at the elbow. So if you're trying to figure this out on your own, do something that causes the pain, right? So maybe it's out here and you're squeezing and you're like, oh, that hurts. Try holding yourself right here. Depending on, you don't have to be, don't be so hard, right? So I put the point of my elbow in my palm and I just kind of squeeze together. Like I'm trying to pull and compress it together, right? And if that helps, you might have some weakness here. So making sure you're working in the right areas is going to really help you get rid of the symptoms. So remember I said your wrist muscles end here, but they started here. So maybe treating this area a little bit is going to help alleviate some of this. This is what we do at my clinic. We figure out where the muscles have an imbalance and we work on fixing it. Now, sometimes manual treatment, like it feels like a massage, but putting the muscles and the joints in the right places can really help. And then we always follow it up with a very specific strengthening. And the type of strengthening just depends on which muscles are out of balance and out of whack based on your thing. So go find yourself an expert therapist who can take a look. I always say that, sometimes you can't read the outside label because you're inside the jar, right? So sometimes you can't see everything your arm is doing because you're looking only from this perspective. When you go to a specialist, they can look at something outside and they can look at everything. So consider that if you have a chronic issue. And this is really important if you're constantly getting injections. Cortisone injections deteriorate at your tendons, right? And usually you never want more than 3 shots in the same place. So keep that in mind. To treat wrist stuff, sometimes you gotta go to the elbow. So that's for this. Now, with ulnar-sided wrist pain, we need to rule out if you have a TFCC problem. So one of the things that I do is there's a crease right here. You see when you go like this, there's a crease right here. I will put my finger in there and I will make them go like this and to the side, like you're going ha-cha, like chopping, right? If there's no pain there, you most likely don't have a tear. But there's a couple of other things, but here's something that you can consider doing. You see this little bone? This is a bone right here. This actually is a wrist bone, but it's actually tied to a tendon. So what happens is sometimes this bone, this tendon, gets really tight. So if you feel real tight down here, that might be what's causing you to have ulnar-sided wrist pain. So one thing that you can do is you can find that nub, right? It's right here. Feels like a hard P. So you can either pull it away from you, like towards the tip of your pinky, or you can shove it towards you, like you're kind of like pushing it that way, right? Whichever direction feels good, that's the direction you want to go into, right? Here's another one. Let me see if I can show you. This is a little hard to do, but you can find this nub right here. That's that pisiform. That's a bone that's attached to a tendon. And then here at the top is your ulnar styloid. And sometimes these muscles are so tight, it's pulling. If you can imagine, it's pulling everything down this way. So if you go and you kind of pop it back up, does that feel better? That means you're real tight down here. So this can help you. Instead of just slapping on a wrist, it can help you. Maybe you need to massage all of this area and then strengthen in a way that's going to help strengthen your whole arm, your shoulder, your elbow. These muscles help to support your hand and your wrist. So if those areas are weak or there's an imbalance in them, then you're going to continue to have a lot of wrist pain. Chronic wrist pain is very hard to diagnose correctly, and it's because you can't see it in x-rays. MRI is going to show you nothing, and those are the two things that most people I know are constantly looking for, because they're looking at like, oh, I want to see what's going on. But believe it or not, you can see through clinical movement. You can see through how your arm moves, how your arm is positioned, in what direction is it positioned, where do you have strength, where do you have weakness. So when you're going to a movement specialist, like an occupational therapist or certified hand therapist, it's kind of like they are watching a movie, right? Versus an x-ray or an MRI are like snapshots. It's like taking pictures, right? So an x-ray is one picture, an MRI is multiple pictures. You know, like on your iPhone, you take a picture and it does like 10 bursts, you know, really quickly. That's kind of like that. But when you go into a therapist and they can look at how your shoulder's moving, how your elbow's moving, how your wrist is moving in different positions in terms of what bothers you, that's like watching a movie and saying, oh, that's why when you put weight through your wrist it hurts, is because your elbow is wonky. It's not moving the way it's supposed to, or your shoulder is not supporting your wrist. This is what I find a lot of times. By the time people are coming to me at Hands-On Therapy Services, they have tried different things. They have tried the braces. They've tried watching YouTube videos. They've tried therapy before. And really so much of it is just about where to focus so that you can get to the root cause. You get to the real cause of what's happening. Majority of these common wrist injuries or wrist pain, they're chronic in nature, and there's a muscle imbalance going on. Find yourself a trusted therapist. Keep looking. I say keep looking, because what else? What's your other option? To be in pain? I know that's not my option. I'm going to keep looking. So if you're like me or anything like me, surgery and injections are sometimes not even an option, even if you wanted it to be, right? Even if you're like, I'd rather have surgery. Sometimes if it's not torn, nobody's going to do surgery, right? So find yourself a trusted therapist. I hope this video helps to at least guide you. This is for educational purposes alone, and I hope this helps you get some understanding in terms of what's going on and what you can do in terms of looking for a specialist to help you. Again, my name is Huang. I am located in Miami, Florida at Hands On Therapy Services. I'll include the link so you can contact my team if you need me. Otherwise, leave me a comment and let me know if this video has helped you. All right, thanks for watching.